Good evening, ladies and gentlemen, and welcome to MedCity's yet another live session. And as usual, I just would love to say hi to everyone. Before I say hi to everyone, I have a great personality here, and she is none other than Miss Sangeetha Ma'am, who is a very familiar face, especially when it comes in terms of OET and IELTS. And of course, she is an expert in IELTS as well as in OET, and I believe tonight her expertise would be a great benefit for people, those who are watching. And ma'am, welcome and good evening.
Thank you so much, sir. And that I would say was really flattering. Thank you for that introduction. And yes, with me sharing screen space is an equally I would say an expert personality when it comes to, or I can say expert trainer, lead trainer when it comes to OET or IELTS as well. So it's my pleasure to join space with you today.
Thank you.
You're doing wonderfully well when it comes to OET live sessions.
Oh, great.
And I'm sure students are very curious to know what the two of us are going to
great.
cook tonight.
Great.
So let's get started.
Sure. So let's say hi to everyone, those who are joining. A lot of people watching out from different parts of the world, and many, let's say starting with Reba says good evening, and Shamlal says good evening, and Sonia says watching, and Aditi Krishna says good evening, then Teslin Thomas says good evening. So ma'am, I think many people are watching.
Yeah, that's right. So good evening to all of you from our end, from MedCity, and it's wonderful to see all of you live. Again, without wasting a lot of time, I'm sure you're all very excited to know what we have to share regarding OET speaking.
Sure.
So let's get straight to the topic.
Right. Okay. Once again, as ma'am said, if you keep on saying hi, so only the session would be for that. So let's get started with, and as we promised, or as it is being promulgated or published, that we are going to talk about OET speaking subtest today. Which most of the students do say it's a tough module, but having said that, it's the one modules that we can absolutely train them over a period of time. I don't think that actually people need to have excellent skills to crack OET speaking, because it's very simple. And right, before we start, let me just give you a little clarity about what exactly OET speaking and how it takes and how long the time goes. And probably I want all of you to understand how long the OET speaking takes exactly when it comes in terms of a day of exam. Probably the time frame that you get it, as you see on the screen, it's exclusively 20 minutes, and there is a short warm-up section which is not assessed at the end of the day. And this warm-up session would be probably 3 to 4 minutes, and then 2 profession-specific role plays, and that's what exactly being assessed on the day of exam. And you get actually 3 minutes to prepare for each role plays. So that's what the most crucial part of OET speaking, I suppose, right? Students need to have a proper strategy to manage that 3 minutes.
Yes, definitely, because many of the students are not aware as to what is to be done in the 3 minutes time.
Sure.
They are aware that they're given 3 minutes to prepare, make notes.
Sure.
But very often we see students probably reading the role play card from top to bottom and making mental notes.
Okay.
And then it looks like they're really staring at the card and probably thinking up stuff that they need to speak. But it's very important. I feel, from my perspective, what I feel is it's very important to make notes, take down points as to what they have or what they're planning to speak in the next 5 minutes.
True, absolutely. What ma'am said is true, because this is not just because actually we are making a comment. It is out of our little experience that we have been associating with the students for the last couple of years. Probably the 3 minutes must be for a proper analysis of the given tasks, because once you start analyzing it, you will have a proper plan. So that's what she was trying to stress upon. And then the role plays take 5 minutes each. I want all of you to look at the screen again and to see that how long does this exam take. Exactly 20 minutes, short warm-up session which is not assessed, and then again 2 profession-specific role plays. So when I say 2 profession-specific role play, what does it really mean to actually?
Well, it means we have around 12 professions
Okay.
who can take up the OET.
All right.
So it's divided into 12 different categories.
Right, great.
As mentioned in their website. So if you're taking up OET for nurses,
Okay.
you will be taking, that is you as in the candidate will be taking up the role of the nurse.
Sure,
So
absolutely.
if you're taking up OET for medicine,
Okay.
that simply means you'll be taking up the role of the doctor.
Doctor. Okay,
Yeah, so
exactly.
that's what profession specific is. And these two are the most common professions that we hear about and listen to. But we have other professions like, maybe physiotherapists,
Yes.
optometrists, veterinary.
Sure,
veterinary
12,
science.
exactly.
Yeah,
You're
exactly.
right. So that's what exactly the meaning when we say to profession specific, a nurse will be always playing the role as a nurse and doctor would be playing always the role of a doctor. Very good, exactly. Now, see, that's all about how long does it take to finish the speaking subtest. Now, what is expected? Now, let's say that students are of, like a different range and understanding of English language. Most of the time, they don't really know what exactly expected of them. Of
Yeah.
course, as you can see that actually they're expected to play the role of the health professional,
Yeah.
as you mentioned. And then, of course, there is the interlocutor. Would you just tell me what exactly interlocutor in this context?
Well, your interlocutor is no one else but your speaking partner.
All right.
Now,
great.
this is the person you're going to meet on the test day, who will be
Alright.
sitting right next to you, in front of you.
Alright.
In front of you. And the interlocutor will be taking up the role of the patient or the bystander, which
Okay.
means it could be one of the parent or it could also be the spouse, like the husband or the wife.
All right.
Now, the interlocutor is not the person who actually evaluates your speaking. Now, many students have this confusion. They feel that it is the interlocutor who actually evaluates and gives them the score, because that is how the IELTS exam happens,
Yeah,
right?
sure.
The person you meet on the test day is your examiner, but that is not the way how OET is set up. So, interlocutor is there to help you, to support your speaking session or the
Absolutely.
conversation.
True. So that's what interlocutor, if you go by dictionary, a person who helps you in conversating, and he is not your assessor. He or she has no right to assess you, rather helps you according to the given tasks. All right, probably the interlocutor, as she said, acts as a patient, maybe a client or a parent or a relative or a carer, and then you have set of tasks. Probably you are expected to ask questions and provide information based on the task given on the cards. So this is what you are expected on the day of speaking. When it comes, you straight away you go to and you experience it practically. Now, what are the things being assessed then?
Well, assessment, many of the students feel it's just grammar. A lot of importance is
Yes.
definitely given to grammar.
Yeah.
But OET speaking is structured very differently.
Alright.
When you take up the OET speaking, it is basically to test the skill of a candidate, the communication skill of a candidate.
Absolutely.
Because what the let's say the board that you're applying to, what they're trying to figure out is whether this candidate can actually handle a normal everyday hospital setting, where you'll have to talk to probably a patient or their bystander. Will you be able to manage
Alright.
different kinds of people, different situations,
Sure.
and if you're going to manage them, how well can you manage it?
Yes.
So these are the things that are being assessed.
All right.
So when you look at assessment criteria, like all of us know, we have in OET speaking two broad categories.
Yeah, sure.
One is the linguistic
Linguistic.
criteria and the other is clinical communication criteria.
Yes,
So, yeah.
exactly. That's what. See, I just want to reinstate what she said, because most often students do come up with this particular complaint saying that my English is too poor or my English is not strong enough to score. But please do understand that of course it's a language test, but precisely they have to this broader generic assessment factors, which is in the form of linguistic. The word linguistic, I think language.
Language, yeah,
Yes,
that's
of
right.
course. So they are checking the language skills and clinical communication skills. Like my simple question tonight would be, do they have a different patternization or sex, something kind of it?
When it comes to your clinical communication criteria and linguistic, of course, we do have. Now, what you have to make a note of is its clinical communication criteria. It's not just communication. Now, communication could mean, like the two of us talking is communication.
Sure,
you talking to your best friend is communication.
Absolutely.
Let's say you've had a very bad dream. You wake up in the morning and you're like, immediately you call up your friend and you talk about what dream you had and why it scares you. That's communication. But that is not what is being assessed in OET speaking. What is being assessed is clinical communication. So in a clinical setup or in a healthcare context, the different kinds of people that you're going to meet or interact with, how will you talk to them?
All right.
That's exactly why we have the term as clinical communication, and not just communication.
Absolutely.
So when we focus on the clinical communication criteria, we still have certain subsets, like you said. We have certain factors that we need to focus on.
Right. Absolutely. Now, this is what the most challenging aspects of OET speaking. Because everyone thinks that it's only because you have a strong English language skill. Not that. That's one element. Of course, a person who has got a strong English skills can absolutely do justice to this. But when it comes in terms of evaluating, the assessor would always look for, clinical communication skills. They have subcategories. I just want all of you to just look at the screen and understand. It's called relationship building, and of course, it needs actually an elaborated session to make you understand what is exactly relationship building. And let's say, if you want to just put it in one word, what would you say relationship building?
It's about how you establish your relation with the person you're talking to.
Absolutely.
So not only establishing, and throughout your conversation you carry forward that establishment that you've made. So do you know the patient? Yes. Is the patient new to you? Yes. How did you establish that fact? And because the patient is new to you, what are the differences you're going to bring in your conversation? Or because the patient is known to you, how are you going to address their concerns?
Yes, absolutely.
So,
and of course, a relationship building, I would rather just add and say it's a rapport that you create and continue till the end of the conversation. And of course, the second one is understanding and incorporating the patient's perspective. Probably this is the the area that students fall apart, and they have a lot of confusion, and they get stuck by saying that word, understanding and incorporating. So they just understand that word, but patient's perspective, that becomes a Himalayan task for them. Would you mind to say what exactly that maybe in a few words?
Yeah, definitely. Now we have two things here. One is understanding and the other is incorporating.
Absolutely.
Now when you understand, it means, let's say now if Johny sir looks really serious and he looks really sad, I understand the fact that there is something wrong, that something is wrong with him. Probably he has some physical strain, or it could be a mental strain. So that is understanding. Now incorporating it would me be including that fact that he has some worry into what the activity that we do. It could be a conversation, or it could be anything. Like if I feel that he's worried, I understand that he has some tension. And incorporating would be when I ask him to say, when I tell him that you please take rest, I'll continue with the session. Okay,
absolutely.
That is when I incorporate it. So you need to understand the patient's perspective. Perspective means their point of view.
Yes, absolutely.
Okay, what they have, what knowledge they have, what awareness they have, what is your point of view. You understand it, and at the same time you need to also include that in your conversation. So only then it becomes understanding and incorporating the patient's perspective.
Exactly. So this is what more often, even I have come across a lot of people misinterpreting this particular idea. So as she said, it's quite natural, you have certain cues. Cues means the signs that is visible. Probably it could be verbally expressed. Some could say that, I'm very much anxious about the chemotherapy process, or I'm very much anxious about blood transfusion. So that is, I express my perspective or my concerns through words. Probably you that include in your conversation, or probably I do have actually non-verbal, cues. Maybe I seem to be a little worried, or I'm a little anxious, or I'm a little frustrated. So this is what exactly, the perspective, if you just read it in detail, it would say that, what the patient thinks and what patient knows about it, what the patient expect from us. So all this must be understood and it must be included in the conversation. That's what exactly.
Yes, exactly, sir.
Yeah.
So we have two questions that have come up because you are completely immersed in explaining this. Let me just read out this question. So the first question is from Reba that I can see. It has come on Facebook, and she asks, can you tell me what the interlocutors are writing? Something on a paper soon after speaking. Is it something related to our performance? So she says there is this action that the interlocutor does probably as soon as you're done with the speaking. They're making a note of something. So her question is this the evaluation of our performance?
Not at all, because the interlocutors, are they assigned to evaluate our performance? Not at all, because it's very specifically and categorically mentioned that the assessment is being done actually with the third party, right? So the interlocutor's job is actually just to, let's say, help us in conversating. That's what my little understanding. I don't know anything other than that.
Come on, sir. I mean, let me just extend that fact and say that it'll be two independent examiners who basically listen to the audio recording and evaluate your speaking. So what do we mean by independent examiners or assessors? It means, let's say, we have Johny sir in some part of the world, he might be in Australia, and you have me sitting somewhere else, let's say India. So the speaking of a particular candidate might be sent to Johny sir, who's in Australia, and to me, who's in India.
Absolutely.
So we do not know that, both of us are unaware of the fact that this is the candidate that we have to evaluate.
Yeah, sure.
So I give my scores, he gives his scores, and the total is, and the comparison is what you get as your score. So the examiners are independent, they don't know each other, so it will not influence your score, they will not be able to influence your score. And the interlocutor, like he said, does have no role, or I can say has no role in your scoring pattern, other than the fact that he or she is there to support you.
Yeah, that's it. One question, even if being part of it, I often heard from the students that some interlocutors are not so that cooperative. They say that actually they are not willing to talk. Sometimes they are reluctant.
Right.
Probably I recently heard actually there is actually a grievances cell or kind of things that where they can complain. Is that true?
Yeah, that definitely is true. Now, one fact that we have to understand, if somebody says that the interlocutor is not responding, not cooperative, it could probably also be a part of the role play. Like sometimes you have as an interlocutor, if I'm the interlocutor, in my card it would be written as do not accept the suggestions given by the nurse or be reluctant to accept, which means as an interlocutor I'm going to say, oh, I'm not really sure, should I be doing it? So I'm not going to cooperate because in my role play card it clearly mentions that I shouldn't be cooperating.
So probably you say that it's actually his role to play that being reluctant.
Yes, definitely. One way is that. But if at all you feel no, the card does not require that, irrespective of which the interlocutor is completely reluctant, non-cooperative, like Johny sir mentioned, you have an option to register a complaint there as soon as you're done with the exam in your exam hall itself. Or even, once you come back, you can probably log into your candidate portal and you have an option of, addressing your redressal there. You can write out what your problem is and your score will not be compromised.
Exactly, because the question from Reshma, what we have to do when the interlocutor is not cooperating. So that's what the question, I think probably we answered it.
Yeah, exactly. And there's one more question. I think I read a question by Jessie. Okay, so Jessie's question is, which one is important? Is it task completion or communication?
Yeah.
Again, that's very relevant.
So probably it's not always actually necessary that you need to fulfill and finish complete tasks. But having said, there is actually an implied sense in OET. Probably it is specifically mentioned in the website that the tasks which are given to the students on the day of exam is precisely mentioned that it can be finished in 5 minutes of time.
Yeah.
That doesn't mean that, if at all you have a little lengthy conversation and at the end of the day, if you're not able to finish 1 or 2 tasks, you're not being penalized for that. You're being assessed only for 2 broader skills, that is actually clinical skills, and the other one is linguistic skills. Probably whether you finish it or whether you conclude it properly is not at the end of the day being considered as marking areas. And that's what I would love to say that.
Yes, and Ambika has a similar question. Is it necessary to complete all the tasks? Well, do not rush on to complete all the tasks, because we found very often students rushing. Let's say they have 5 or maybe 7 tasks given, and they are aware of the fact that probably they'll not be able to complete all the 7 tasks in 5 minutes.
Absolutely.
So what do is their only aim is to finish all the tasks.
Yeah.
So without giving ample time to the interlocutor, which is the patient, or without letting them speak at all, or even talking to them, basically what students do is they perform all the tasks one after the other.
Right.
And that, my dear friends, is going to cost terribly. It's going to cost dearly on your scores, because it's a conversation that is required, and not let's say some kind of a presentation. Okay? It's not a speech that is required. It's a conversation, and for a conversation to happen, just like we're sharing screen space and having a conversation right now, we're letting each other speak. So that should happen even in your OET speaking.
All right. Okay. I think that makes really sense. One more thing that I really would love to ask you, because like when I was just having an interaction with the students, they all asked me a simple question. Sir, the most important thing, or the most challenging thing actually, how to really begin their conversation in different settings. And because everyone knows that the settings like are different. The first role play setting is totally different from setting the second role play. Probably you will get a hospital ward, but the ward can be different, right? Casualty ward, maybe like let's say post-operative ward. And is it not really challenging that a student like have lot of confusion? How do I really initiate the conversation? Would you love to say that there is a specific system, or you need to understand that setting and start your conversation?
Well, for one, I would say there is no specific system as such, and the real reason why they're giving you 2 role plays to enact is to see if you can bring about that difference. Okay, so let's say if I have a system in place, or if I have a structure that I follow every time, which also means that for both the role play cards, I'm going to have the same kind of beginning, the same kind of initiation, and that simply means that I have memorized certain structures. Again, I'm using it. I'm not thinking. I'm not ready for the real scenario. So it's kind of a giveaway. I'm making it so much easier for the examiner to reduce my scores. Because I've started both the conversations in the same single manner, and the message I'm conveying to the examiner is, I'm not very good with English. I have memorized certain structures, and I'm going to use the structure no matter where you put me.
All right.
What the situation is, I'll say only this.
All right.
Yeah. So you need to make sure you have.
Yeah. So adding to that, like this like the way that you begin your conversation is also comes under actually an assessment factor, right?
Definitely.
So if you think of actually clinical clinical communication.
We have relationship building.
Yeah, yes, exactly. We have relationship building. I just would love to all of you just to have a little look on this what you call relationship building. Just give me a minute. The first one is actually relationship building. Probably, like relationship building, of course, it has got subcategories. It says actually, like initiating the interaction appropriately by starting greeting somebody else, introducing yourself, and letting know them the nature of that conversation. So that's what, like students are becoming a little more apprehensive. They are a little more scared of it. See, come on. Greet, of course, everyone greets. I would say hello, good evening. That's fine. Maybe you introduce yourself, okay, saying that, hello, my name is Johny Matthews, and I am an OET trainer working at MedCity. And then there's something else called nature of interview. Now, why did I bring this one? Because this is a sensible question, student. How do I possibly start this conversation when it comes in terms of a home visit? Right, the scenario is different. How do I really start when it comes in terms of an emergency? Because the patient condition is so emerging, or it is so such a serious, and you cannot go and say that, hello, how are you doing, and all. Probably that becomes so awkward. So would you say that actually, do you have a specific say that, okay, this is how when it comes in terms of home visit? How do you just begin, if at all?
Okay, so the thing is, we'll have to imagine how that scenario actually happened. So imagine you going to somebody's house. Home visit means a healthcare professional visiting the patient in their house.
Absolutely.
So we are going to the patient. Now when we go to the patient, there's a difference. Right?
Absolutely.
When we go to the patient, we have to introduce our reason for visiting the patient
Alright.
in his or her
So
house.
let me just give you
introduce.
just give me a little scenario.
Sure.
Now let's say you are actually a community nurse.
Okay.
You're expected to make a review visit because Mr. Brown has undergone a total hip replacement,
Okay.
and you're going for reviewing his condition. And but provided, and you need to be that you are visiting for the first time that.
Okay.
Right. Could you please explain the difference of maybe a nurse who already visited and you're visiting for the first time?
Okay, so if I'm visiting for the first time, I'll have to first, of course, even if you're visiting for the second time, you'll have to introduce yourself.
Sure.
Okay, so maybe I can begin with like a greeting. Like he said, you need to start with a greeting. So I can start with, hi, good morning, or hello, good evening, hi, nice to meet you. So this would be my greeting.
Absolutely.
Okay, or I say hello and I start.
Right.
And then I say, so my name is Sangeetha and I'm a nurse in the community health center. So I've introduced myself.
Yeah.
And if I have an appointment, I would say that I have an appointment with Mr. Brown. Okay.
True.
Is this the right time? Is he free now?
Yes.
Okay. So I'm inquiring if that's okay to talk to him. And at this point, probably I expect the interlocutor to say, "Oh, please come in and have a seat." I expect. Okay. So if that doesn't happen, also it's fine. But I expect. Then I would say fine. So because this is my first visit, I say I need to give a briefing of why I'm here.
Okay.
So I brief on what I already know about Mr. Brown. So I already know, I mean, without knowing that he's had his hip replacement, without knowing the fact that I'm there to assess him, I wouldn't be there in the first place.
Obvious.
So I'll say, see, from your report, or I know that you just had your hip replacement, maybe like, let's say 2 weeks ago, and I'm assigned to review your progress. So I'm here to check on your progress. Is that okay with you, or shall I go ahead? So here there's a lot of clarity because I've started with greeting, I've introduced myself, and I've also used a little bit of the background information given in the role play card saying, I know you've had this particular surgery done and my purpose of visit is for a review.
Alright. So I think that makes sense because like we are trying to justify all the assessment elements because you introduce yourself. First and foremost, you greeted, you introduce yourself, and there's actually a nature of interview. Probably this is what everyone should understand. Why am I here? And that's what exactly called the nature of interview. Now let's say when you go to a discharge ward, you are expected to explain maybe the discharge plan to the patient. Otherwise, why do I go there? So probably it's always better to say that, like let's say that, probably just make it other than OET. See, I come as a police officer to your house. I don't have a right to actually just arrest you unless I express myself. Hello, my name is this and I'm a police officer from here and I'm here to arrest you because of this reason. And that's what actually a formidable and formal conversation, and I think that is what exactly applicable when you say nature of interview. Right.
Now if you're trying to show, like you said the other scenario, if you're trying to show that you already know the patient you visited before, you can connect it by saying after the greeting, of course, you don't have to introduce yourself, but after the greeting, when you say, hi Mr. Brown, you can say, how are you doing today? And you can say, oh wow, you look so much better than when I met you last week.
Absolutely.
I hope things are fine now. So that establishes the relation I share with Mr. Brown.
Absolutely.
So the scenario is the same, the setting is the same, it's a home visit. But one is I'm meeting for the first time, the other it's a follow-up visit. So there are differences in how we need to
Ma'am, a
start
few
the
questions.
conversation. Yeah, sure.
Sir, can I ask the patient name while we get preparation time? So if the name of the patient is not given, should the name can be asked in 3 minutes or should it be asked in between the conversation? Right. What do you have to say about this one? I think it's a non-thing, but still maybe.
Yeah, I know. I mean, it's good to ask such questions because probably we know it or somebody else knows it, but there would be candidates across who are not fully aware of this, or these minor confusions are still there. So the question was
the question is asking whether can I ask the name that during 3 minutes
the preparation time,
or should I ask during the role play?
Okay. Now, if you have a role play setting which says you're the bystander, like maybe you're the son and your father was admitted and you're here to discuss your father's condition.
Absolutely.
Okay. So the patient is the bystander. I mean, the patient is there. You're talking to the bystander. The interlocutor is a bystander. In such a case, it's always advisable to check with the interlocutor what is the name of the patient,
absolutely,
who's admitted, and what is the name of the interlocutor. I mean, the bystander. How should you be addressed? Because the scenario here is that the patient is already in the hospital. Okay. So it is better if you can probably use their names in the conversation. But let's say if it's a clinic okay, or a community health center, and the patient is coming to your place for the first time,
absolutely,
then there is no necessity to ask the person's name, because that can come as a part of the conversation. Because you're visiting for the first time, and I can just begin saying, "Good morning, please take a seat. I don't think you've come here before.
No.
Could you please tell me your name?"
Yeah, it's quite natural. So probably you would say that actually, if it is a non-case, you could absolutely ask this name in that 3 minutes of preparation.
Yes.
Exactly. See, if it is a hospital ward, presumably, or we assume that there could be a chance that you have actually a non-relationship because the patient has been in the hospital for last 3 days.
Yeah.
So it, it is implied that you are actually known to each other. So probably you would think in mind, so then I can easily ask, okay, how may I address you during the session or during the role play? So that means during the 3 minutes of preparation. Now, what happens if the examiner says, so if the interlocutor says, please ask me during the session, if at all, what happens?
If at all that happens, let's say it's a known case, now the interlocutor is not cooperative probably, or maybe the interlocutor feels not necessary to give out his name. In case of a known patient, of course, it's not really good to ask, can you tell me your name? But there is a procedure if it's a hospital ward where we can always cross-check the patient's details.
Absolutely, that's what we want.
Yeah, you can probably say,
for the confirmation.
For confirmation, could you please state your name and date of birth?
Absolutely.
So for confirmation means I'm doing rounds probably in the hospital. The patient is already admitted. I know the patient, but it is my requirement there as a nurse. My duty is to check the patient's name, because I might go to the wrong person and this is something else altogether. Well, that's criminal, my dear friends. It's a criminal offense there. So it's always better to clarify things before we proceed further.
That's what, this question has, been asked many occasions. If the interlocutor says that actually please ask during the conversation or during the role play, probably you could say that actually, would you mind telling me your name for the confirmation's sake? So that means what you're confirming and reconfirming that the person that I'm going to treat or continue the care is the same person. As she said, probably you would treat X or Y the crossway. That can be actually, dangerous.
It's an offense, Okay. So we have somebody watching all the way from Brazil. I think his name is, I'm really sorry if I'm pronouncing it wrong. I think it is Isais Moraes from Brazil. Thank you so much for joining our live session. We also have a question. Oh God, okay, I think I've missed the question. Okay, it's a question from Chinnu, and the question is, if in the task, last task is written like establish patient consent in this scenario, do we need to take the sign in the consent or orally take permission from them?
Okay, right. See, of course, the scenario that is being created for exam is actually similar to what you're going to face in your real time. And most often, let's say that it's actually asking for consent, right?
Yeah, consent.
Now, let's see. We ask questions. I want to actually talk about this one. We really ask questions, maybe very personalized question, or we also ask actually, is that okay if I proceed with the procedure at this moment? Now let's say I'm very much apprehensive about a blood transfusion, but the doctor says that actually I have lost a great amount of blood, and having said my condition is stable, so I'm really up against actually, I'm really scared of blood transfusion, and because I heard actually even things can be, infection can go wrong, something. So please, I'm dead against it, because I have read it somewhere else, this activities has caused actually a person to get infected with HIV, and this is all those things. I'm up against the procedure of, moving with blood transfusion. See, here you're going to ask the consent. Of course, you do a lot of tasks convincing him, and finally you would ask actually a consent, right? So probably, would you really, in our role play, we start, practice and show writing down? No, not at all, right?
Not required. We can imagine, that's the situation. We can also say probably at the end of the conversation, I'll need you to sign the consent form. I'll bring it in a while. Maybe give me a minute so that I can take your sign. You can say that verbally, but you don't have to actually, show your paper and ask the interlocutor to sign on it. But you can imagine probably that could be the situation. You can say it's our hospital procedure to get consent from the patient before we go ahead with the entire transfusion. So we have this consent form that needs to be signed.
Ma'am, we have Ampika question says, yes, when we are administrating medications, always cross-check patient name, agent, ID. And that's absolutely sensible, because
we also have a question from Sarita Dinakar, and
Okay.
she's put up a scenario saying, if the patient is Angel and the interlocutor is Angel's mother, okay, then we can call Angel's mother without asking her name. So her question is, the patient is Angel, it's given in the role play card, it's Angel, but we're talking to the mother. So can we keep saying Angel's mother, Angel's mother?
Yeah, see, that's what I think ma'am already mentioned, like you act as a bystander of your dad, right? Even then, like you always make sure that, of course it's written actually, because that's a scenario and that's a setting, and we rather call it a background statement, right?
Yeah.
This is the background and Angel's mother. But it's always quite natural, and it is actually, it's formal, very formal to say that actually, could you please say your name? And then we would ask, what brings you here? Then she would say that, okay, my daughter, cut her finger or something like that, and she hurt herself, and blah 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 blah. Then you'll ask, actually, could you please say the name of your daughter, right?
Yeah.
So probably you would never say that Angel's mother. Would they be like?
So let's imagine, sir, somebody coming in and we're like, okay, please have a seat. How should I address you?
Yeah.
Or how may I address you?
Often.
And then the person gives the name. Okay, sir, please tell me what's wrong. So let's say Maria. So we'll say, hi Maria, how can I help you?
Yeah,
so
absolutely.
Maria would definitely see my daughter has cut her finger. So our next question would definitely be, oh, is it? So what's your daughter's name and how old is she?
Yes, exactly.
So we get both their names. We get Maria's name and we also get Angel.
Yeah.
And the age, and that's how we proceed.
Absolutely.
So, see, my dear students, let me tell you, there is nothing so much that you need to memorize or a strategy format as such. Just be very natural. Imagine, if it's any other person just walking to you, it is so much courteous for us to ask their name, because
Absolutely.
It's always I would say accepted. It is polite to call somebody by their name and speak to them, than saying, hey mister, hey look here, hey man, hey woman, hey lady. That would be really demeaning. That is not appropriate. So it's always better to address a person by their name. And when you address a person by the name, just be careful with the age factor. Like in your role play card, it says you have a 60-year-old person and he's given his name as William Smith, and you say, okay, William, so you need to do this. No, he's 60-year-old. Let's be very courteous and say Mr. Smith instead of saying William. That would be much more polite. But if you feel that you start saying, Mr. Smith, would you like to talk to me? And he says, hey, call me William.
Yeah, then it's fine.
All right.
Then it's fine. It's fine.
Then he can say, yeah, William. Okay.
So I have a question here. So how to use that 3 minutes of time? All right. Okay. How to utilize 3 minutes with the given task?
So Tijo has asked that question, right? Tijo Thomas.
Yeah. So yeah. We are going to come up with a specific session for how to utilize that 3 minutes, because it cannot be just narrated, at a stretch for just 5 minutes of time. We have to take a specific task, and we have to, so when you, let's say for example, so the setting is being given, and the first task is actually sympathetically ask the patient what he knows about stroke. See, you have to build the relationship, and they have to gradually flow up to that, what you call the question. And the next is actually reassure him the importance of taking oral medications. So you have to assess in between. So I talked about this one, and then, the next task is actually reassure. Probably I could easily analyze and say the question might be asking that whether this medication is actually workable, whether it is safe. So probably this analysis cannot be just done actually just 2 minutes of time, probably in the classroom, I mean to say that. Of course, having said you have only 3 minutes, but that 3 minutes preparation has to be dealt in a bigger scenario or in a bigger classrooms. That's what I believe.
Okay, so because you've asked this question, let me just summarize what you can quickly do. Of course, in those 3 minutes time, make sure you read from top to bottom. That is, don't miss out any important points. Start from the setting, because the setting will let you know, the relation that you're going to have with the patient, or what situation the patient is in. Like, if you see ICU, you know immediately it's going to be a very, something that requires immediate attention. But if you see a general ward, it's going to be a more lighter scenario. So start with the setting, read the background information. As you read, underline all the keywords there, because you need to make sure you're not using any technical terms. So if you find any technical term, make sure you write the synonyms and the simpler versions of it. Go through the tasks one by one and make notes. Like he said, if it's to ask question, make sure you write down questions there. Okay, so it needs to be dealt in a bigger session. So probably we'll have a complete session dedicated to
absolutely,
that.
Absolutely.
But this is the crux of what you can do.
Exactly. And I have Naina Raj, a beautiful question here. How can we start a conversation when the patient is waiting for his or her result, which is not so good? So that means what, breaking a bad news.
Yeah, probably. Now you have to be very careful when breaking bad news. I mean, we cannot lie. We need to be honest. That's important. Okay. So if things are not good, I cannot say, oh, everything is fine, relax, don't worry.
Absolutely.
That's not accepted. But again, I cannot say, oh, it is very serious, you're going to die soon. I mean, I need to, be somewhere in between where I'm giving out the right news, but at the same time, I'm not being very harsh.
Absolutely. So of course, when you, when you come up with, the bad news, we would always say that I'm afraid. I think this might be a shock at this point. But let me just say this. You have actually certain expressions which can be used effectively breaking the bad news. Saying that actually I'm afraid this might come as a shock. But let me tell you that I have the result of your son who has actually or who has been diagnosed with a tumor at the back of his brain. But let me assure you that we have identified very early stage and he's in the safe hand. So you express and you let the person know that the bad news, but still we have actually certain expressions, right, which can console the patient, right? As ma'am said, actually, okay, your son has got this, he is going to die. All of a sudden, come on, let's be very sensible. And having said that, probably students should learn this kind of actually expressions, how possibly we can break actually certain, bad news or good news or whatever it may be. Now,
there's a question I can add on to what you're saying. This is Priya has asked, could you please tell me how to speak empathetically? So probably she's looking out for certain phrases that she can use to express empathy.
I could actually ask you people to have a look on the screen because I have shared a few expressions. Maybe when you start, there are a number of expressions. And I would rather encourage students to, learn rather than just being cliched, because most often people are, sticking to one particular phrase and they think that that's the end of the world. Probably you can say that, 1, 2, 3. There are plenty of expressions. You can see that, so I know that how you must be feeling at this point. I understand your concern. I see your concern, or I understand how you're feeling now because it's sad to know that your son has been diagnosed with this. I can easily relate to that as a mother because even I have gone through the same pain of delivering a baby. So these are actually the expressions, effectively can be used, and that has to be learned by heart. And it's not just being learning by heart, you have to incorporate as in a real time situation. Maybe let's say that see, I'm really scared of chemotherapy because I heard it has got certain side effects, so I'm a little apprehensive about it.
So how do I respond to it?
Yes.
Right? So let's say your name is George. So I say, relax, Mr. George. I completely understand how you feel. I know it's not easy once you realize the fact that you need to have chemotherapy. But let me also assure you that this is not the first time that we're doing chemotherapy on a patient. What we can do to make you feel much better is probably discuss what the procedure is. Let's also discuss what are the possible side effects. And we'll surely also talk to you about how you can manage those side effects.
Oh, that's great actually.
Would that make you feel really
Absolutely, I'm okay with it because I was really scared about. See, I hope that this is how, probably it's actually just one or two, a sample things that you can do it. But I really want all of you to learn these expressions which is, available everywhere. So please, it is not actually somebody else particular, specific, property to just hang on. You all can use it actually. And I want once again to see that actually the desktop and to see maybe a few expressions. And there are a lot of expressions to express empathy, acceptance, and if you come in terms of actually encouraging. Now probably a few expressions you could say when you encourage somebody else. It would be great if you could follow a proper diet. So these expressions, of course, they are going to be handy and helping you to score high. Probably that's what I want to say. Yeah. Any other questions?
So even when you let me just add on. There are two questions that I've just tried pinning. They are similar questions. So adding on to what Johny sir has just mentioned. Yes, we need to learn these expressions, but when we use them, it shouldn't look like we've memorized it. I mean, it should come with the right intonation. We should feel that what we are saying. So it's okay to by heart these expressions, but try and use them naturally. So we have a question from Sneha Mole and Anil Kumar. Very similar questions. So Sneha Mole's question is how to deal with a psychiatric patient, and Anil Kumar's question is, sir, could you please tell me how to deal with a mentally disturbed young patient?
All right. Okay. So when it comes in terms of mentally disturbed young person, see, the first thing is actually we understand the mental status of the patient. And we understand actually still we have certain tasks, right? See, other than tasks, what would you try? That's my question. Now let's take a scenario that I come to you and I have actually what you call, let's say, mental status that is imbalanced, or I'm really, I'm an aggressive patient.
Okay.
So that could be probably because I think that you have kept me unnecessary, right? I met with an accident, and of course, physically I'm fit. I don't have bruises, I don't have cut, I don't have bleeding, nothing that sort. I'm so much scared, so I don't know what's happening, and I become so angry. Now, would you actually have your own method of treating, or do you have a task to be followed?
Well, we have a task to be followed, but
Absolutely.
at the same time, we also need to talk to the patient. We need
Absolutely.
to address the patient.
Absolutely.
So we need to say something like, yes, I can see that you're really disturbed. I know there are things going in your mind. Would you like to share them with me so that probably I can help you out? So we need to lend out our ears to our patient.
Absolutely.
So probably they can vent out their feelings or fears or problems. They might feel better once they vent it out. And it's also important because we can know what exactly their concern is. Right?
Absolutely.
Now maybe if he says, I'm just worried, I'm there in the hospital, why am I in the hospital, I need to go. So we know that is their concern. So how are we going to convert that into our
task?
The task.
Yeah, this is what I would love to say actually. See, I don't really claim that, two of us coming here and just talking to is actually the panacea, the absolute solution for OET speaking. I don't really believe it. But having said, this kind of conversation probably would give actually a little sense to the people who are really willing to know it. So that's one thing I just would love to say that because this is not a mockery to actually try to make people feel bad about it. Rather, coming back to the question, it is a session where we try to share actually a lot of concerns that students asked. Probably this question these all questions are asked by a few students, and there are people who might have many questions. So probably one person question when I answer equally answering to maybe 1,000 who has got the same question. So let me come back to your question. So this mentally disturbed, probably that scenario is good. Now when you get that scenario, having said, she said actually you need to lend yourself, which means what? It's also checking actually your ability to build relationship with such people. When you're mentally disturbed, how sympathetical and how empathetical that you become. So you break all these paradigms and you just go straight to and you say that, okay, I deeply understand that you are in a disturbed mind, and don't worry, I'm here to help you with. It's okay. Do you need some time to settle down yourself? Come on, there are so many ways that's called relationship building. At the end of the day, you started at the beginning stating that there is no set rules that this has to be this. But there is only two set rules. You justify the assessment factors. Simple as that.
That's it. So that's an excellent response to it. So of course, it completely depends on how they respond. Now if whatever concern they share with us, we need to try and address that concern. Whenever we're talking to a mentally disturbed patient, we need to be careful not to aggravate their condition, not to probably, maybe arouse their anger. So we need to try and calm them down. That's important. So accordingly we need to use softer words. We cannot use any sharp words like you're mentally ill or you need a psychiatrist. Okay, So those kinds of things should be avoided. But at the same time, if you feel things are going out of hand, you also need to be stern. So there are certain situations where you need to be stern. There are certain situations where you'll have to tell the patient, I understand you need some more time, okay, to get used to this new situation. So why not I come back later, maybe after an hour's time, and have a conversation with you?
Absolutely.
Yeah, so that should be. It completely depends on the scenario. So we cannot learn a particular method or a way and come in and try and use it. It depends on how the other person responds. Now, Jessie Rachel has a question. Her question is, sometimes students ask the name of the patient after collecting some information from them. Is it correct?
The situation must be, made it very clear. So, in the sense, is it actually kind of home visit? Is it like what exactly she
So,
might...
probably, I don't know, Jessie, I think this is what she means. Like, you start a conversation, you say, okay, how may I help you? And the patient says his or her problem. And then you realize, oh, I didn't ask the patient's name. And then you say, would you mind telling me your name?
Absolutely.
She asks if that's okay.
That's fine. That's accepted because that's how let's put it. Probably I would say that actually you all need to think of actually the mother tongue scenario. Now let's put it actually how it's being dealt in actually Malayalam, Tamil, Telugu, Kannada, Bengali, Sandali, whatever the language that you speak. Think of actually this is only a language difference. The medium of expression is just different, but at the end of the idea is the same. So let's say that someone comes and you start, the conversations, and all of a sudden you just forgot everything, saying that probably you need to have the appointment of that patient and still the name. Probably you missed out. You could absolutely say, I'm sorry, could you please say your name because I forgot. Nothing wrong in that.
Yeah, true.
Nothing wrong in that. Would someone actually penalize for me?
So Jessie, relax. That's fine because it's very natural for human beings to forget certain things. But you might lose your score if you don't ask the name at all. You realize it and you're like, my 2 marks are not asked. But yeah, it's fine if you and it depends on how you put it across. Like you can say, oh, I forgot to ask your name. Would you mind telling me your name, or how do I address you?
Yes.
Okay? And okay, I think Ong Ellen is reiterating something that we've already said about psychiatric patients. So he adds his comment saying, psychiatric patient need more concern and patience.
Absolutely true. We absolutely accept that. That's a great point. Maybe made it the explanation short and sweet. Great, actually. So we went on with a great explanation. So yeah, ma'am. But the point is that there are a lot many questions, and the absolute solution is actually we do have MedCity's OET app.
Yeah.
Of course, which contains all detailed explanations of tasks, and then the methods and the grammar part. What all else, if you could add something about that.
We have over 50 hours of video lessons, and our mobile app can be used anywhere, no matter which part of the world you're in. It's available on the Android version. We have it on the iOS version, and we also have podcasts, interesting audio clips, all health related, so that it will completely orient you to the OET listening pattern, the kind of conversations you're going to listen to. We have practice materials, sample answers, and lots more.
All right, okay. So therefore, encourage you to go and download this app, because I always believe, let's put it to the promotional elements the aside. And let's say that actually, I want actually to clarify certain doubts. I don't know that I could call up somebody else in the late night and ask them the doubt. Probably when I have a handy device with me, I just open it. And that's what we always, anything that you want, you just rush to the Google and you search it. And MedCity's app is an absolute solution for that. And please make use of it. And
we have a question from YouTube. Abdul Jalil Khan. He's asked, if a student has a problem of stammering, is this problem, will it affect his or her marks? Stammering.
Yeah, that's absolutely questions to raise our eyebrows.
No, because see, even in IELTS we have this option of mentioning any disability if at all.
Absolutely.
So if you need any additional assistance, probably if you have an eyesight problem or things like that, you have additional assistance. But remember, OET is for the medical professional, so you're taking up this test to be able to work in a foreign country. Now, if you're medically unfit or you have certain disabilities that might hinder the working, it might be difficult. But stammering is not considered a problem as such, because if the examiner understands, but it's always good, when we book the exam, if you have an option, you can always mention it there. If you have any such shortcomings, you can mention stammering. Not that it will be considered as such, but the examiner is aware that you have a problem. So probably in that light, they will be, checking or evaluating your performance. So just because you stammer, you're not going to lose a lot of marks. But if it is really bad and you're not able to express at all, and understanding you becomes really difficult, of course you're going to lose marks.
Okay. So, even, before I just came to the session, I had a chance to meet few students, and they were also a little worried about asking questions. There are polite way of asking questions, they call it actually open-ended questions, they call it actually closed questions. Would you mind saying a bit about that, what exactly this open-ended and closed questions?
Yeah, of course, my pleasure. Now, we have these two kinds of questions, like open-ended and closed-ended questions. Like the name suggests, open-ended means you're allowing the person to speak at length. Okay? So closed-ended means I will already have a prepared response, like options. Like if I say, do you smoke?
Yes.
You have to either say yes, you
No.
have to say no.
Yes.
There's nothing else you can say, right? So that becomes more of a closed-ended question. But if it is open, I might ask a question like, maybe, how often do you smoke? Or could you explain when you started this habit of smoking? Now I'm letting you talk in detail. Like, you might explain things like, I started when I was in school.
Absolutely.
I was,
Yes.
So these are the two kinds of questions. Now it's good to have a mix of both open-ended and closed-ended questions. Do not think that you should always have open-ended questions. Sometimes closed-ended questions are also important.
Yes.
So these are the two kinds of questions.
All right. Okay. So when you start asking these two things, either open-ended question or closed question, directly you are justifying the assessment factor called information gathering. Right. Of course. But that also depends upon your sensibility towards the situations. Now, let's say, as she said, you ask a question, do you smoke? Probably your answer is too limited to yes or no, wherein you are just closing the possibility of extracting a lot of pieces of information. Rather, if you ask, would you mind narrating a bit about your lifestyle choices? Probably. So it would, give you a rather wider perspective from the patient view and say that, well, I love smoking cigarettes, and I'm also a person who is keen of using, or consuming alcohol. Probably sometimes I go with actually 300 to 400 ml per day. Trust me, weekends I also hang out with my friends and I enjoy social parties, and I'm not so keen about doing exercise. So this might have given you a great amount of information, and that's wherein we give importance where to ask, as she mentioned it. Actually, it's a situation where to use actually an open-ended question and where to use a closed question. Am I right? Actually?
Yeah, that's true. But again, it completely depends. Like,
Yes.
what he said. If it is not required, never ask open-ended questions. Like,
Never.
We asked, are you vegetarian or a non-vegetarian? He said vegetarian. Now you're like, okay, I should ask open-ended questions. What kind of vegetables do you cook? How do you get these vegetables? These aren't necessary questions, though they are
Absolutely.
open-ended questions. So only what is required should be asked. So yeah, that's definitely something that you need to keep in mind.
Yes. Or
we have another question from Jessie, and it's regarding repetitive questions allowed in speaking. I'm not sure what she meant by repetitive question.
That's what. Probably, is it actually, again asking about what was your past medical things, or is it actually again asking, do you have other habits?
Maybe, there are certain expressions that we use, like, do you have any other concern? Do you have any other concern? That could be maybe what Jessie means by a repetitive question.
Probably
you shouldn't
that,
be repeating phrases often then.
Yeah, that might be the thing that she mentioned it. Okay, because there's clearly saying that a repetitive phrase and phrasal verbs can be accepted, actually something that hinders your language ability, because we do have that as well. And probably that might be she making as mentioning tonight.
Yeah, but only one more thing that I can add on to when you're asking open-ended questions, like he explained his, he gave a sample where he's explaining his habit of drinking, and never ever say things like, "Oh my God, you drink so much of alcohol, that's insane." Now, if I say something like that, I'm being judgmental. So I know that's wrong, but I mean, I shouldn't be saying things that open. Probably I can say, "Oh, I don't think that's good for your health," which is okay, but not, being very expressive there and saying, "Oh, that's really bad, you shouldn't be doing such things and that's not good," and
Yeah, absolutely. Do we have any more questions to be addressed and answered tonight?
So Jessie says, if question is asked again and again. Okay, you need to make sure that you're not asking too many questions. Okay, so break down a task into maybe 3 or 4 questions maximum, not more than that. So don't extract a lot of information.
That's what, because this is one concern that we could really talk about. People do think that as part of relationship building, you can start asking so many questions, or if there is something else to know about habits and routine, you just keep on asking the questions. Meanwhile, you fail to do the tasks, which could have been easily given a chance to be empathetical, to have actually what you call perspective gathering, information providing, information giving. So when you try to deviate yourself, you are also probably limiting the chance of justifying the assessment factors. Probably that is at risk. And I think that's what people need to understand when you go with a lot of questions and dragging up the things. Probably for the sake of finishing that 5 minutes of time. No, but
I think we're almost to the end of our timing, and before we wind up, let me read a very sweet message from Noha Haddad. I'm sorry if I've read out your name wrong. He says, "It's always a pleasure to see you both."
Thank you.
Ms. Sangeetha and Mr. Johny, thank you so much.
Thank you.
And with that, I think we are to the end of our session.
Yeah, absolutely. So keep watching, and the next time, see, this was actually randomly capturing your doubts and clarifying. But next session, we are going to come up with each assessment factors individually, and we are going to talk about how to prepare the 3 minutes and how even go about with that warm-up session as well. So thanks a lot, and for your great time, keep watching. Thank you. Bye-bye.
Thank you so much.